Hello, Dog TV. Joe Meyers back here for another Dog TV Chats. I want to thank you all for joining us this week. We've had some amazing guests this upcoming week. Tomorrow, we have a pet blogger talking about some of the top products that you need during this pandemic. So stay tuned to that. On Friday, we'll be talking to Dr. Ross Henderson from the Animal Planet show, Hanging with the Hendersons. He's a singing veterinarian, so come back on Friday for that. Next week, we have Dr. Nicholas Dodman talking about the science behind Dog TV and some other amazing guests that I'll announce at the end of the show. So hold on for that. But there's a big question in the pet space. If you've been to a pet convention or a conference or know somebody in the pet space, this is something they've talked about. It's on the top of everybody's mind. And today we're going to bring you one of the foremost experts in the area, in the arena. Yes, we're talking about CBD. And yes, we have one of the most qualified people on earth talking about this subject. Please welcome Dr. Trina Hazzah. Welcome to Dog TV Chats.
Thank you. Thank you so much for having me. I feel very honored to be here.
Excellent. We're so lucky to have you. You are a doctor of veterinary medicine, a certified veterinary Chinese herbalist. You're a founder and co-founder and co-president of the Veterinary Cannabis Society, member of the Societies of Cannabis Clinicians, and about 12 other titles and associations. First question we have, hard-hitting, when do you sleep? That's the big one. Incredibly knowledgeable and in tune to this whole environment.
I find, you know what? You find a way. You find a way. And I think when you have a passion towards something, you don't want to sleep, right? Like I wake up and I think about what if this, what if this, what if I could find a product that could work for this disease or that disease? And I think when you're so scientific and so passionate about something, there's no end, right? It just continues on. And I hope to be part of this, really this mission in finding safe, effective cannabis products, hemp-based and marijuana-based for pets. I think there's certainly a place for it, and there's a lot we're able to do and make pets feel so much better in more natural ways.
Excellent. Well, if you have questions, this is a very rare time that she's answering questions. So if you have questions, please add them in the comments below. We'll try to get to as many as we can. I know we have a lot of people watching right now, so please be patient. But let's start top line. What is the difference between cannabis, hemp, and marijuana?
God, that's a great question. I think we're getting that question all the time. People come in and say, I have a hemp product or I have this product. What does it really mean? Cannabis is not a bad term, right? People say, well, I don't want cannabis. I only want hemp. Well, guess what? It's all the same thing. Basically, marijuana is this cannabis is this umbrella term for both marijuana and hemp. Okay. Essentially, if you think about it, and the way I like to describe it is it's almost like toothpaste, right? So cannabis is the name for toothpaste, and hemp and marijuana are just varieties of toothpaste, like Crest and Colgate, right? So they're essentially the same exact plant, and especially when they're grown medicinally, they actually look almost identical. The only difference between the two plants, marijuana and hemp, is that the hemp plant has less than 0.3% THC. THC is that intoxicating, that compound that makes a pet or a person high, right? That's the only difference. They both have CBD. They both have these terpenes, these aromatherapy, right? These essential oils. They both have other what we call cannabinoids, these compounds that have physiologic and medicinal products. They're essentially the same. They have the same family, the same genus, the genus and species of cannabis sativa. They're just varieties of cannabis. That's all it is.
Wow, that's a good way of putting that as like the brand name and the subject matter there. So there's so many different products out there in the market. If you've been to a pet convention, or maybe if you even Google the term, you're going to see a bunch of them. What is the difference between broad spectrum, full spectrum, or the isolate products? What are the sort of the difference there, some of those terms?
Yeah, so broad spectrum, so that you see a lot on a bottle that says this is a full spectrum, this is a broad spectrum, right? The true difference is the diversity of compounds, the spectrum of compounds. So with full spectrum, the true definition that is out there right now is you have variety of cannabinoids with THC included. Okay, so as long as you has THC included with some other, just some other compounds, you are considered full spectrum. If you have THC that's removed and you have other compounds in there, they're calling it broad spectrum. In my opinion, and I think in a lot of experts' opinion, that term really isn't appropriate. A full spectrum definition should state that it is the compounds that are found in the original plant that was actually grown. If you were able to take it out and process it and make it so the medicine has all the compounds, all the cannabinoids, all of the terpenes, again, those are the essential oils, all of the flavonoids that give the plant a specific color, that purple color or more green color, that really is what should be considered full spectrum. That means all of those compounds that came from the original plant that made it into a medicine, that is full spectrum, regardless if it has THC and CBD. In my opinion, and a lot of other experts' opinions, that's really what it should be, because that means people can be calling something full spectrum when it just has CBD and THC, right? If you went with the previous definition, it really should be as most diverse as possible. The amount of cannabinoids at whatever levels you can find, you really should be looking for a product like that. Or what they would consider broad spectrum could still be lots of cannabinoids and terpenes, just not the THC. So and then the isolate, of course, is just finding the one compound. So let's just say with all the processing, they pulled out just CBD or just THC. That would be considered an isolate, which is usually about 99% pure of just that one compound. Okay. Yeah. When you look for a product out there, the best way to try to treat yourself, in my opinion, but I'm not a human doctor, even though I like to play it sometimes on TV, or treating your pet, is you want to go as full spectrum as possible. And why does that matter? It's because science, this research in science is really catching up, right? We really need to get to more, we need more information out there. At some point, we will know exactly which compounds are needed at what doses to treat which specific diseases. But until we know that, it's unfair to deprive yourself, your pet, from compounds that may actually be super important to treat a condition. For instance, let's talk about this. For instance, you have a product that you're looking at that has CBD, THC, and one terpene called let's call it beta caryophyllene. That's the name of a terpene. A terpene, again, is an essential oil that gives a plant a certain taste or smell, okay? If you took out beta caryophyllene and you only gave your pet CBD or THC, what if it didn't work very well, right? What if the pain, your dog is still limping and is still uncomfortable? When you find the product that has the beta caryophyllene, it may work synergistically with THC and CBD to boost its effect. So now you have a product that works really, really well. It's those minor cannabinoids and those terpenes that play such an important role. And until we know exactly which ones are needed, I would say as diverse as you can go in your profile, the better chance you have to treat a condition. Excellent. Granted, we do adjust the doses of CBD or THC or terpenes to treat a specific condition. Does that make sense?
Definitely, yeah. So the broad spectrum is sort of the full, as it comes from the plant. That's the recommendation. The other ones sort of take things out, and without truly understanding what your dog needs and the synergistic relationship between them, taking them out is not really the best course of action today. I get you?
Say that one more time. I just missed you.
Oh, sorry about that. Yeah, so the full spectrum is exactly as the plant is today. The full intent of the plant, and then the other ones are sort of isolating and removing certain elements of that. Is that sort of what you're saying?
Oh, Joe, I'm sorry, you're breaking up really badly. I think everyone's on Netflix right now, so it's hard to hear.
Gotcha. Sorry about that, everybody. Hopefully, I'm not the only one experiencing it. Is that better? We're going to try to fix that technical issue. Hopefully we can get Trina back. If you have any questions about this subject matter, please add them in the comments. We'll try to get to as many of those questions as possible. And we can certainly go from there. So let's try and see if we can get Dr. Trina back. Dr. Trina, are you back with us?
Okay, can you hear me?
I can. Can you hear me?
Yes, it's still breaking up a little bit. I don't know what's going on. I'm so sorry about that.
No worries.
I don't know if it's my side.
Well, let's move on to another question. Should pet parents be concerned about products that contain THC?
Great question. Should pet parents find products with THC? You know what? It depends on what you're trying to treat. Some conditions, you really need some THC to really potentiate the effect of the CBD and other compounds.
Oh, are you still there?
Are you guys still there?
I am, yeah.
Hello?
Hello.
Okay. Yep. Oh boy. You can hear me?
I can, yes.
Okay, let's give this another shot and see how it works. So it depends on the condition you're trying to treat. Sometimes having some THC is actually very important for certain conditions like cancer. I think we have some evidence to prove that THC certainly has some anti-cancer properties. It's not where I'm not saying that CBD doesn't and some of those other minor cannabinoids and terpenes don't. They absolutely do, but there's a lot more research on THC having anti-cancer effect in ways of reducing tumor, what we call proliferation or growth, or inhibiting new blood vessel formation that is essential for cancers to grow and spread. It causes cancer cells to commit suicide, essentially. And so THC really has, I think, a major role in cancer. Again, is it going to be for every cancer? No. What I think we'll find as more research comes out is there's going to be certain cancers where using more CBD and less THC, and other cancers where THC is going to be more important than CBD. But I certainly think THC has a role also for severe pain. Not the typical, mild to moderate arthritis, but really severe neuropathic pain, bone pain. In my experience, when I have dogs that have bone cancer as patients, right, and they're in significant pain, the CBD products by themselves tend to not do the trick. And when I add in a little bit of THC, it makes all the difference. It allows these patients to feel significantly better. Sometimes they're dosing them 3-4 times a day just to cut that pain. They've been on morphine, they've been on fentanyl, they've been on all of the typical tramadols and gabapentins, and those aren't touching the pain. But once you add in some THC, it really makes all the difference. And I think I think it certainly is anti-inflammatory. THC affects different pain pathways. But one of the big things that THC does is it actually causes a change in that perception of pain, right? So that's something we don't talk about. I think a lot of people say, well, THC makes you high, so that's bad, right? But high isn't necessarily bad. There's a spectrum of high, right? So if you were a little bit less anxious, right? You took that's also causing a psychoactive effect, right? And some of that pain that it causes in your body causes anxiety. So by reducing some of that anxiety with the combination of CBD and THC, changing that perception of pain by changing or altering the brain activity alone can be enough where pets are feeling happier. They're much more able to go on walks and do things. When you speak to people with fibromyalgia, for instance, a lot of people will say, well, when I use products with THC, my pain, I still feel my pain. It's not totally gone, but I feel so much more kind of alive, and I want to go garden. I want to go for a bike ride. My perception of pain has changed so much that I'm able to do the things I enjoy. And I certainly see that in pets as well.
That makes a lot of sense, where like the pain might not go away, but the understanding and perception of pain certainly does as well. What advice can you give to pet parents in finding a high quality CBD product?
There's, I would say that you really, really have to go with a reputable company. I would not just go into Amazon and say this one has 10, 100 stars or 5 stars or whatever one is, and they have great reviews and not really know the sources of those reviews. I worry that their number one is safety, right? You're giving your pet medicine. This is considered medicine in that you're using it to make your pet, say, feel better, less anxious, less arthritis, whatever it may be. And I worry that people are just going out and buying things without actually doing the research. And I get it. I buy a face cream without doing the research. It's safe for me to do that. But putting something into your body without doing the research, especially a plant that has what we call bioaccumulation effect. What does that mean? It means that this particular plant, hemp even more so, has the ability to suck everything that's in the soil. Okay. And that may be good when it has good nutrients in the soil, but when it has heavy metals like lead, that becomes very problematic, because then the end product may have lead in it, and that can be very toxic if given over a long period of time. Even if at low doses, over periods of time, it could be problematic, right? So heavy metals. What about pesticides and herbicides and things that people are using, fungicides people are using to treat these plants so that they don't die, right, from insects and things like that? There's something called a certificate of analysis, or a COA. You hear people use that term. And that basically is a piece of paper that a company needs to send their product into the lab, and then they get this piece of paper back. In that piece of paper, it tells you, is this product free of pesticides? Is it free of fungicides, heavy metals, solvents, residual solvents? So what is that? What does solvents mean? Solvents is what they oftentimes use to pull out the plant compounds when made into a tincture or a liquid substance that you give to your pet. Okay. And so in what they call a concentrate. So when we suck out the compounds, they use a solvent to break that down, things like butane and ethanol. If it's not washed out properly, you can have these residual butane in a product. You don't want to be giving that to your pet. Can you imagine you're treating your pet for cancer and then you're giving them butane, which is a carcinogenic substance? So really contacting that company and saying, I've gone to your website and I don't see the certificate of analysis. I'm not comfortable using your product until I have an up-to-date one. And an up-to-date would be within 6 to 9 months of that batch, 6 to 9 months of you using that product. That's going to be essential. The other part of the COA that is very important is it tells you what's inside the medicine, how much THC, how much CBD, how much terpenes, how many. If you don't know what's in a medicine, how do you know how much to give? So I give you a bottle and I tell you this is aspirin, but you have no idea how many milligrams of aspirin you're taking. Do you take 1 pill, 2 pills, 3 pills? That you would never give your child that. Your pet kids are your children, and you would need to know how many milligrams of each compound you're giving your pet.
I love it. I love that, asking for that COA, making sure it's up to date, making sure that it's a high quality product. So 2 questions coming from the audience. The first is, do pets have I'm going to butcher this word, I'm not a science teacher by any means, a cannabinoid system similar to humans?
We think they do. There is some research out there actually looking at it. The one big difference between pets and humans when looking at the endocannabinoid system, or what we call ECS, is there's 3 parts of the ECS. You have receptors, you have these endocannabinoids, or these compounds, and then you have these enzymes, right? The big difference between humans and pets, specifically dogs, is they actually have many more of these CB1 or cannabinoid 1 receptors in their brain. Dogs do. And they've looked at it back in like the 70s, and they looked at the density of these receptors. And they found that CB1, or these particular receptors that are responsible for THC binding to it and causing that psychoactive or intoxicating high effect, there are so many more in the dog species than any other species, including the human. And why that's important is dogs are more sensitive to THC. So if you gave a person the same amount as a dog, right? Or you gave a dog the same amount as you gave a person, a dog would get high much quicker because they have such a large density of those receptors. And that's very important for veterinarians to know. So when they talk about dosing with THC, they have to be very, very careful that we need to be very gradual in what they call titrate or adjust the dose very, very slowly so we can get these receptors primed and ready for a little bit of THC versus a person. That titration or adjustment can happen much quicker. So we do have some information, especially in rodent models as well, not just dogs and cats.
One question: where along the spectrum of uses should somebody consider a CBD product if their dog is having, when should it start? I'm having some pain. Should you start with CBD or should you start somewhere else? Where should that sort of you have an issue, where should you start with a CBD product? Is it the first course of action? Is it, after you hear something, from your doctor? Where should people start on this?
Great question. I think that I'm an integrative oncologist, so I believe in Eastern medicine and in such a major way. And I would say if you can go onto something, so say your pet had a mild condition, you're starting to notice they're a little bit more sore, or it's hard for them to get up and down from, or in and out of the car. It's starting to get more difficult. Well, why start a prescription medication that has a list of side effects when you can start something like an Eastern medication or an Eastern herb like cannabis, right? And so if you can confirm that the product is completely clean, right, lack of contaminants, that it's safe for your pet, then I would say always, why not start with something like that and save the prescription medications when these herbs aren't doing the trick. And in my experience, a lot of times when the prescriptions aren't doing the trick, the herbs actually do a great job. So can we not keep some of these pets on herbs for much longer and getting them and keeping them away from some of these prescription medications until we absolutely have to go there? So I would say in my opinion, why have any pain if you don't need to? Right? Why? We don't like being in pain. So if you're noticing your pet being uncomfortable, talk to your veterinarian, have a conversation and say, I don't know if I really want to start, say, a non-steroidal anti-inflammatory that has problems like liver, kidney, potential for GI ulcerations. What do you think about starting a cannabis or a hemp-based, a CBD product and seeing what that does for my pet first? Do you recommend any particular product? Would you recommend I go to any certain sites to find reputable product, right? And I think Great Pet Care is one of these sites that has a lot of information, and it has a tremendous amount of information from veterinarians that myself, for instance, I'm a board certified oncologist, that speak about the importance of CBD for pets on that site. And I think you'll get a lot of information from sites like that as well.
Excellent. We do have a question, but I love that starting there. Start with the solution that has the least amount of side effects to reduce something that nobody should deal with. If you had a splinter in your finger, you don't cut off the finger. You try to take it out. Sort of using a big hammer for a small problem initially, I think, is a good place to start. We do have a question here. This is from Kay. Explain priming. And I'm not familiar at all. So if that doesn't make sense in this context, we can skip it. But what is priming and how does that apply?
Yeah, no, that's a great question, Kay. So when I use the word priming the receptors, essentially what that means is getting the body used to it. So remember what I mentioned, there are these receptors, right? And THC actually binds to that particular CB1 receptor. Well, our bodies, when we have no experience to cannabis, which I don't know any pet that sits outside and smokes a joint. So I would go with most pets, 99% of pets, unless they're in a home full that, full of cannabis, likely have what we call a naive system, right? They've not ever been exposed to it. And so they have actually a low level of these receptors. If you go too high, then you essentially clobber those receptors and you end up getting more negative effects than positive effects, right? If you start very low, what happens is the body says, hold up, this is a new thing. My receptors haven't been used to this. I'm going to start making some more receptors, right? And I'm going to do it in a gentle way. So you end up getting a lot of the good parts, right? And you actually, as you start developing more receptors, your body becomes, you heard of the word tolerant or tolerize, just like you think of like you become tolerant for a substance. So your body becomes tolerant to THC, so you don't get any of those negative effects, but you start getting more of the positive effects. So this priming is just getting your body used to it and creating some more receptors so you don't see negative effects and you start seeing mostly positive.
Excellent. So you're sort of getting a tolerance up for it, but for the positive side of it. I'm going to combine two of the questions that we have here. Somebody says they have a small dog, a little Shih Tzu. Is there special dosage for smaller dogs? And does application method matter? Cookies, tincture to the ear, brownies, like what's the recommended source of the application method? You said hi earlier, so I had to follow up with the brownies.
Well, and I'll start by saying never give your dog a brownie, right? Unless it's a chocolate-free brownie. We call it a blondie, right? So let's start with the first. Is there a dose for your small Shih Tzu? And I would say that there isn't a dose for one particular breed or one particular set size of dogs. When I think about dosing, I think of lots of parameters, right? One of the biggest ones, more than just size, is age. So older dogs tend to need less than younger dogs. Even if you have I've had dogs, a small Chihuahua that's 2 years old has 2 to 3 times the dose than the 10-year-old Great Dane. Wow, right? So it's not just size, I'll tell you that. It's actually has to do with age, has to do with what we call comorbidities, meaning other diseases that your pet may have that may play a role in how much your pet needs. This ECS, or this endocannabinoid system, is a system we all have in our body and all your pets have in their bodies. The entire goal of using a cannabis-based, and I say cannabis meaning marijuana and hemp all together, the whole goal is balancing the system. Just think about it like that. It balances. So why, Joe, you may need a different dose than me, is that perhaps you need less balancing than I do. I may have many comorbidities that make it where I'm going to need more of a balance, meaning I might need more of cannabinoids than you do. So it may not be a size thing or an age thing, or it may be many factors. Are they on many medications that may play a role or interfere with how much your pet needs? So I would say one size certainly does not fit all, and you really have to my recommendation always is you start very low and you titrate or increase that dose very slowly until you find that optimal dose for your pet, which will be a different dose in the pet Shih Tzu next door that is the same size as yours. So that would be that answers the first part of your question. The second part is, well, there's so many different formats now, right? You have or applications, you have tinctures, which is basically a liquid form in either an alcohol base or an oil base. It's rare that you ever find alcohol base for pets, right? Most of it's oil base, usually in a coconut or sunflower oil or something like that. And the benefit of using that is it really goes to the theory of we can start low and go up and find your optimal dose, right? First, if I had a capsule or a treat, how do I then break the treat into 8s or 16ths and start with a 16th? What if the cannabinoids are not what we call homogeneous or evenly distributed? You may give that corner that has 90%, right? So these are questions that you'd want to certainly ask, but I never recommend breaking these treats or breaking a capsule, because that would be very difficult. Really, what I would say is starting with an oil makes a lot of sense. if your pet will tolerate it. And then once you find that optimal dose, now you have the ability to say, hey, my dog's optimal dose is 5 milligrams. I just found a really cool bar or a treat that gets you 5 milligrams per treat. I'm just going to start giving this to my dog as a treat. And then when I need to titrate up again, maybe
Yeah.
I'll combine a little tincture with a treat and figure out another optimal dose because my dog now is a year older and has more arthritis or whatever it may be.
Yeah. So you sort of
Right?
start small, find that ideal dosage at the time for your dog. It seems like even at the time, because of course, as you know, we sort of all gain those comorbidities as we get older, you know, unfortunately.
Indeed.
And I've heard that word way more in the last 2 months than ever. So yeah, no, I love that. And then starting to build up and then really figuring out what works. I didn't even think about the homogeneous spread out on those cookies. If you break off a little corner, you're sort of making a big assumption there.
Right. And so contacting that company, because what if you have a pet that hates the taste of the tincture? Cats, that's a great example. I have a cat at home named Harold, and Harold has some, anxiety and some GI inflammation. And it's a joke when you see me running around the house with a syringe trying to give this cat, his hemp, right? It's just his hemp CBD product. It doesn't work for him. So I've tried putting it in some really tasty soft food or sardines or something that's really strong and pungent that takes over the smell of the cannabis product. So that's worked a little bit. Also, I think finding a treat that your pet likes, if they will not do tincture, is another way. Some dogs, you think about the big Labrador who will eat anything. That dog, you could probably put it on the food and they just lick the whole plate, right? So every dog, just like every person, is so unique. And I think you need to really think about your pet's uniqueness when you pick a product.
Awesome. Well, you've been so helpful today. Absolutely. As I said at the top of the show, one of the foremost expert in this area. Can you leave our audience with maybe some final thoughts on CBD in general, sort of where it's at, where is it going? Maybe there's a pet parent that wants to try this out but is nervous and worried. What are your sort of words of wisdom?
I would say be patient. Be patient. We as veterinarians, as scientists, are really trying to figure this all out, right? I mean, I think that we will, and I'm hopeful that I will be part of that figuring it out and really make sure that I can tell you which compounds are needed for what disease. But right now, I would say the take home is go as full spectrum as you can so you don't miss something. Start as low as you can with the dose and really find a product out there that is suited for your pet. And is safe for your pet. And some of the ways to do that is find reputable sites. I think I mentioned Great Pet Care is a really phenomenal site that gives pet parents really honest, kind, education for your pet so you know exactly what products are safe. Also, we'll talk about veterinarycannabis.org is another company that actually provides consults for pet parents. If you live in a state that you don't know what to use and you're looking for even a marijuana product, contact them. They do wonderful consults for pet parents that help really support you guys in finding the proper product. What I think is difficult is veterinarians are a little bit handcuffed when it comes to what they're able to discuss with you. Many states don't even allow veterinarians to discuss or let alone recommend a product. So just be patient with your veterinarian. Understand that they are going to do the best they can. Many veterinarians are going out to get educated on this subject. We never learned about this in veterinary school. And so just really do your best. Ask your veterinarian, come with information and say to your veterinarian, I found some of these products. Can you help me figure out which one might be the safest? And really looking at COAs, contacting the company yourself and asking these really difficult questions. Why is your product better than this other product? Why can't I find on the COA that your product is void of pesticides? I don't see this here, and I'm worried about using this in my pet. Those are, and finding good resources, I think, is an important thing. And just be patient. In time, we're going to really start to solve this. But right now, I think we have enough evidence, both scientific and anecdotal, that I do in my heart believe that there's a huge space in the medical and veterinary medicine for cannabis as a whole, both marijuana and hemp based, understanding that hemp right now is federally legal. So that's why there's so many products out there. And being able to go to things like a website like Great Pet Care and getting their advice as to, or their guidance, I'm sorry, through the educational articles as to what products might be safe.
Excellent. Thank you so much for your insight, for your expertise, for your tireless work in this area. Thank you for losing some sleep so our dogs can have better lives. Where can people find out more information about you, the work you do, where you're writing on? Where can they find out more information about you?
Yeah, thanks for asking. If you go to I have a website, drtrinahazzah.com. There you can get more information about me. We talked about greatpetcare.com, where you can get a lot of really wonderful curated and articles written by veterinarians. And then lastly, the veterinary cannabis.org that allows you to have consults for you, so you know kind of where to go with your pets if you have further questions. And I just wanted to say, Joe, it's been really, truly an honor to be here. I feel that I've been given the gift to be able to help as many animals as I possibly can. It's not just going to be dogs and cats. Hopefully it will be horses and cows and other animals, birds. And there's a little turtle we're treating now with CBD oil that's actually doing wonderful. So I think that it's a gift that I'm able to do this. And thank you for allowing me to share today.
Excellent. Thank you so much for joining us. It was an absolute pleasure. Come back tomorrow where we talk to a pet blogger on some products during this pandemic. And then on Friday, the singing veterinarian, Dr. Ross Henderson from Hanging with the Hendersons. Check it out here on DOGTV Chats. Dr. Trina, thank you so much for joining us, for sharing your knowledge and for the work you do. Absolute pleasure. And thank you all for joining us. We'll be back here tomorrow with another DOGTV Chats, 1 o'clock Eastern, right here on the Facebook page on DOGTV. Thank you so much, Doctor. Have a wonderful day, everybody. We'll talk soon.
Everyone be safe.
Stay safe, everyone. Talk soon.